You're exhausted. You're taking prednisone and dealing with insomnia, mood swings, moon face, or any of the other 150 side effects of prednisone. And I need you to hear this. What you're experiencing isn't random. There's a documented reason that prednisone does this. And there's one critical mistake that makes everything worse. A mistake most doctors don't even warn you about. I know this because I've lived it. Not just as a pharmacist, counting pills and dispensing prednisone from behind the counter, but also as a patient experiencing every single one of these devastating side effects. I'm going to show you exactly why this happens, the mistake that's making your side effects worse, and what you can actually do about it. But how did I find this out? It was October 2017. I was a young mother with 4 small children when my body turned against me. I developed a life-threatening autoimmune condition where my immune system started to destroy my platelets faster than my body can make them. That's a part of your blood. I started bleeding internally. When they drew my blood at the dermatologist's office, my platelet count was only 12. Now, normal is between 150 and 400. I was at 12. By the time I got to the emergency room, I was all the way down to 3. Barely detectable. One wrong move, one bump, one fall, and I could have bled to death. They admitted me to the hospital and immediately started on 60 milligrams of prednisone every day. The prednisone saved my life. Within days, my platelet count started climbing. But what I didn't understand, even as a pharmacist, was how deeply prednisone could affect every part of my life. I knew the side effects on paper. I'd studied them. I'd counseled patients on them. But knowing something intellectually is very different than living it, right? The insomnia hit first. Savage, relentless insomnia. Then came the personality changes. I became irritable, short-tempered, someone my own children were afraid of. The weight gain, the moon face, the bone-deep exhaustion. And when my condition flared again, and I needed 4 rounds of immunotherapy infusions combined with more high-dose prednisone, I hit a wall. One afternoon, after being up most of the night with prednisone insomnia, I was lying in bed trying to take a nap. My sweet toddler was lying next to me, peacefully sleeping. I was more exhausted than I'd ever been in my entire life. I desperately needed sleep to recover, to have the energy to be the mother my children needed. But even lying there in the quiet, with my child sleeping peacefully beside me, I couldn't fall asleep. My mind was racing. My body was wired, and I kept thinking, there has to be a reason. There has to be something we're missing. And that's when it hit. I'm a pharmacist. I have access to clinical databases that most patients and even most doctors never see. I already knew that prednisone depletes calcium and vitamin D. That's basic pharmacology. The American College of Rheumatology has guidelines about it. But as I lay there, I realized, if prednisone is depleting calcium and vitamin D, what else is it depleting? I was so curious, so excited to finally have a direction, an answer, that I jumped out of bed and went straight to my desk. I started searching every database I could access. Natural Medicine's database, clinical pharmacology, Lexicomp, Micromedics. And what I found changed everything. Study after study, documenting nutrient depletion from prednisone. One comprehensive review alone documented 97 human studies showing depletion of calcium, vitamin D, potassium, and sodium. 97 studies. But that was just the beginning. I kept digging. Over 150 peer-reviewed studies and articles in total. And I discovered that prednisone doesn't just deplete calcium and vitamin D. It depletes at least 11. Calcium, vitamin D, vitamin K2, magnesium, melatonin, chromium, potassium, folate, B vitamins, vitamin C, zinc. And suddenly everything made sense. Magnesium depleted? No wonder my mood was a roller coaster of emotions. Melatonin actively destroyed by prednisone. That's why I was lying awake at 3 a.m. Chromium depleted. Research shows that when it's replenished, that can actually reverse prednisone-induced diabetes. Every single side effect I was experiencing traced back to a nutrient deficiency. And that's when I realized the mistake almost everyone on prednisone is making. We just accept the side effects as is, just part of the medication. We don't realize they're preventable nutrient deficiencies. Your doctor probably told you these are normal and expected. What they didn't tell you is there are specific, scientifically proven strategies to fight back against this nutrient depletion. Strategies backed by over 150 peer-reviewed studies. Strategies that could have prevented my suffering and can prevent yours. Here's what shocked me. The information exists. It's published. It's in peer-reviewed journals. And yet, most doctors aren't telling patients about it. Not even the calcium and vitamin D part they're supposed to be telling about, and has been established for decades. Sitting at my desk that afternoon, discovering study after study documenting nutrient depletion from prednisone, I realized if I didn't know this, and I'm a board-certified doctor of pharmacy and third-generation pharmacist with access to databases, how is anyone else supposed to figure this out? That moment became my mission. Because what I realized is this. These aren't side effects that you have to accept. These are deficiencies that you can address. In this video, I'm going to show you the 5 mechanisms prednisone uses to steal the nutrients from your body. Go deep on the 11 specific nutrients that prednisone is depleting. Why this causes the exact side effects you're experiencing right now. What the research shows about prevention, including that landmark review of 97 studies. The exact solution I created after nearly dying and having to take prednisone. This isn't going to be a quick 5-minute video with surface level tips. This is comprehensive, evidence-based, and potentially life-changing. Because nutrient depletion from prednisone is too predictable, too well documented, and too important to your long-term health to ignore. You're already dealing with a health condition that required you to take prednisone in the first place. You shouldn't have to suffer through preventable side effects on top of that. Now, before we dive into each specific nutrient, I need to explain something fundamental. What exactly is nutrient depletion? Because understanding the mechanism, understanding how prednisone causes this, is what finally gave me hope. It meant this wasn't just random bad luck. It was predictable, preventable, and addressable. Drug-induced nutrient depletion happens when medication interferes with how your body absorbs, uses, or retains essential vitamins and minerals. It's not a side effect in the traditional sense like nausea or headache. It's a direct biochemical consequence of how the medication works. And here's what's so frustrating. Houston wrote, "I was prescribed prednisone. The only side effects I was told about were sleeplessness and weight gain. After 7 years, I am suffering from joint pain, insomnia, anxiety, weight gain, increased eye pressure, and other symptoms. I was unaware prednisone was depleting my body of valuable vitamins and minerals." 7 years! Houston took prednisone for 7 years before he ever became aware of this. And he's not alone. Most people taking prednisone have never been told about nutrient depletion, even though it's one of the most predictable consequences of taking the medication. So let me show you exactly how this works. There are 5 main ways that medications deplete nutrients. And here's what makes prednisone particularly devastating. Prednisone uses all 5 mechanisms simultaneously. It's not just blocking absorption or increasing excretion. It's doing everything at once, a perfect storm of nutrient depletion. Let me break down each mechanism. Mechanism number 1, reduces absorption. The medication blocks your digestive system from absorbing nutrients from food. Think of it like putting a screen over a drain. Water still flows, but nutrients can't get through into your bloodstream. You're eating healthy foods, but your body can't extract the vitamins and minerals like it normally can. Mechanism number 2, increasing excretion. The medication makes your kidneys flush out nutrients faster than normal. You're literally peeing out vitamins and minerals before your body can use them. This is especially true for water-soluble nutrients like B vitamins, vitamin C, magnesium, and potassium. Mechanism number 3, interferes with synthesis. Your body makes some nutrients itself, like vitamin D from sunlight or certain B vitamins from gut bacteria. Medications can block these processes and production pathways. With prednisone, this is particularly devastating for melatonin, the sleep hormone your brain is supposed to produce naturally. Mechanism number 4, depletes cofactors. Many nutrients need helper nutrients to work properly. For example, calcium needs vitamin D to be absorbed. Vitamin D needs magnesium to be activated. When medications deplete one nutrient, it creates a cascade like dominoes falling, affecting multiple nutrient systems. Mechanism number 5, increases utilization. The medication puts your body under extra stress, fighting inflammation, managing blood sugar, dealing with metabolic changes. Your body burns through nutrients faster than you can replace them with diet alone. It's like revving your car engine constantly at high RPMs. You're going to burn through fuel and oil faster than normal driving. And here's the cruel irony. The people who need nutrients the most are losing them the fastest. You're already dealing with a chronic illness that required prednisone in the first place. Your body is already under stress, already fighting. And prednisone, the medications that's supposed to help, is simultaneously stealing the very nutrients you need to heal and recover. Now, the extent of depletion depends on what I call the 3 Ds. DNA, your genetics, some people are more susceptible than others. Dose, how much prednisone you're taking. Higher doses equal higher depletion. And duration, how long you've been on it. The longer you take it, the worse it is. But even in healthy people, taking just 1 dose of prednisone or a closely related medication can have profound effects. Prednisone belongs to a class of medications called glucocorticoids. You may also hear them called corticosteroids or simply steroids. Those terms are often used interchangeably in medicine, but they all refer to the class of drugs that mimic cortisol, your body's primary stress hormone. Prednisone is most commonly described as a glucocorticoid. In scientific studies, however, researchers often use a different member of the same family, such as dexamethasone, methylprednisolone, because they all have essentially the same effects. And that's exactly what happened in a 2015 study published in Scientific Reports. Researchers gave 20 healthy young men a 4 milligram dose of dexamethasone, a glucocorticoid in the same class as prednisone, and then tracked what happened to their metabolism over the next 4 days. They measured 214 different biochemical markers in the blood. 150 of them were significantly disrupted. That's roughly 70% of measurable metabolic processes from just 1 dose. Even more striking, many of these effects lasted over 30 hours, and the body's natural circadian rhythm, the internal clock that regulates hormones, blood sugar, sleep, and repair, was almost completely suppressed. Think about that. These were healthy young men who took 1 dose, and the majority of their metabolic system was thrown completely off balance. The researchers observed changes associated with increased diabetes risk, bone breakdown, muscle protein loss, altered stress hormone signaling, and even shifts in brain-related chemistry. The authors concluded that a single short-term exposure of dexamethasone produced what they described as severe metabolic deregulation. And remember, this was in healthy people who didn't need the drug in the first place. Most people taking prednisone are taking it for weeks, months, or even years, already dealing with chronic illnesses or inflammation, often older with slower recovery abilities, which means the cumulative metabolic damage and burden is likely far greater. Let me give you an analogy that really helped me understand this. Imagine you have a plant, a healthy, thriving plant. Now imagine you stop watering it, remove it from sunlight, and drain the soil of nutrients. What happens? The leaves turn yellow, growth stops, it becomes weak and vulnerable. It's not that the plant suddenly became defective, it's that the environment can no longer support the plant's basic needs. Your body on prednisone is that plant. Calcium depleted, bones become brittle. Magnesium depleted, managing your mood becomes impossible. Chromium depleted, blood sugar goes haywire. Vitamin D depleted, immune system weaker. Melatonin depleted, insomnia at 3 a.m. Potassium depleted, muscles cramp and weaken. But here's what changed everything for me. The part that gave me hope. These aren't side effects that you have to accept. These are deficiencies that you can address. Multiple studies show that supplementing the depleted nutrients can prevent or reduce many prednisone side effects. Not all of them. Prednisone is a powerful drug with complex mechanisms, but many of the most debilitating ones, the bone loss, the insomnia, the blood sugar problems, the muscle weakness, these are directly linked to nutrient depletion, and they're preventable. So let's break down exactly what prednisone is depleting from your body. I'm going to go through each nutrient, what it does, how prednisone depletes it, what the research shows, why it matters to your symptoms. This is going to be detailed, but it's important because once you understand the mechanism, you can't unsee it. You'll finally understand why you feel the way you do, and more importantly, what you can do about it. Let's start with the big one, the nutrient depletion that can literally break your bones. If there's one thing most doctors know about prednisone, it's this. Prednisone causes bone loss. In fact, it's such a well-known problem that it has its own name, glucocorticoid-induced osteoporosis. And here's what most people don't realize about how quickly this happens. I certainly didn't realize it when I was taking it. In the first year of taking prednisone, about 5 out of every 100 people will experience a vertebral fracture. That's spine fractures, the kind that can happen without you even realizing it at first. A fracture in your spine within the first year. You only realize that it happened when you're shorter than you used to be. This isn't a maybe someday problem. This is happening to real people every year they're on these medications. And here's the most important part. Research shows that bone loss starts early, which means that protecting your bones from day one is critical. It's essential. But here's what your doctor probably didn't tell you. Bone loss from prednisone isn't just one problem. It's a mixture of 3 simultaneous nutrient depletions working together to destroy your bones. Calcium, the building blocks of bone. Vitamin D, the absorption key. Vitamin K2, the traffic director. Let's start with calcium and vitamin D because they work together. This is how it should work. You eat calcium-rich foods, dairy, leafy greens, fortified foods. Your small intestine absorbs that calcium into your bloodstream. Vitamin D dramatically enhances the absorption of the calcium. Without adequate vitamin D, your body absorbs far less calcium from food. Once absorbed, calcium travels to your bones where it's deposited, keeping them strong and dense. What prednisone does is prednisone attacks this process from 3 different angles simultaneously. Mechanism number 1, prednisone blocks calcium absorption in the gut. Prednisone directly interferes with calcium absorption in your intestines. Even if you eat plenty of calcium-rich foods, your body can't absorb it efficiently. Mechanism number 2, increases calcium excretion through your kidneys. At the same time, prednisone makes your kidneys flush out more calcium through your urine. So you're absorbing less and excreting more. Double hit. Mechanism number 3, decreases vitamin D activation. Your body has to convert inactive vitamin D to its active form to use it properly. Prednisone interferes with this conversion process. Even if you have vitamin D in your blood, it can't work as effectively to help absorb calcium. The net result, your bones are being robbed of calcium faster than you can replace it, even through diet alone. But wait, it gets worse. Because prednisone isn't just stealing calcium from your bones. It's also actively destroying the bone-building machinery itself. Your bones are constantly remodeling, breaking down old bone and building new bone. This process requires 2 types of cells: osteoclasts, cells that break down old bone, and osteoblasts, cells that build new healthy bone. In a healthy person, these are balanced, but prednisone does 2 devastating things. First, it increases osteoclast activity, ramping up the bone breakdown. Second, it kills off the osteoblasts, the cells that build bone, through a process called apoptosis, or programmed cell death. So you have more cells destroying bone and fewer cells building bone. It's like having a construction crew that's lost half of its workers while the demolition crew has doubled in size. And this happens fast. Research shows that glucocorticoids cause a rapid decline in bone strength within the first 3 to 6 months, mostly due to this increase in bone breakdown. After that, there's a more gradual continued loss due to decreased production of new bone. Here's how common this problem is. A study of postmenopausal women on long-term glucocorticoids found that over 37% had asymptomatic vertebral fractures. Fractures they didn't even know they had. When researchers looked at specific conditions that people were taking prednisone for, the numbers were even more alarming. Polymyalgia rheumatica, also known as PMR, 43%. Other vasculitis or connective tissue diseases, 43%. Asthma or COPD, 38%. Rheumatoid arthritis, 34%. Lupus, 31%. That means if you have one of those conditions and you're taking prednisone long-term, you have between a 1 in 3 and 1 in 2 chance of developing vertebral fractures. Not 3%, not 5%, 1 in 3 to 1 in 2. And these are silent fractures, ones you can't feel, that are damaging your spine without any symptoms. Another major review confirms glucocorticoids induce fractures in 30 to 50% of long-term prednisone users develop osteoporosis. Not 3%, not 5%, 30 to 50%. And yet, here's the gap in care. Despite having clear clinical guidelines on how to prevent this, research shows that only about 15 to 25% of chronic prednisone users are receiving bone density testing or appropriate bone protection therapy. That means roughly 75 to 85% of people taking prednisone long-term aren't getting the protection they need. This isn't controversial. This is basic endocrinology. The American College of Rheumatology published clear guidelines specifically about this for doctors. The guideline says, for all adults on chronic prednisone at a dose of 2.5 milligrams a day or more for longer than 3 months, they recommend optimizing dietary and supplemental calcium, 1,000 to 1,200 milligrams of elemental calcium daily. Vitamin D supplementation, 600 to 800 international units daily or more to maintain serum vitamin D levels of 30 to 50 nanograms per mil. Now, your body can only absorb about 500 milligrams of calcium at a time. This is a critical detail most people miss. So how to optimize your calcium intake? Take 500 milligrams of calcium in the morning with food and take 500 milligrams of calcium in the evening. Get additional calcium through your diet throughout the day. So why do we need to split the dose? If you take 1,000 milligrams all at once, your body will only absorb about 500 milligrams of it in the gut. The rest is wasted, going down the toilet. By splitting your dose in 2, morning and evening, you absorb significantly more calcium from the same amount of supplement. And here's the good news. You don't have to get all your calcium from supplements. Here's what a practical day might look like. In the morning, 500 milligrams of calcium supplemented with breakfast, 1 cup of yogurt with 300 milligrams of calcium. Throughout the day, 1.5 ounces of cheese with 300 milligrams, fortified plant milk, 300 milligrams. In the evening, 500 milligrams of calcium as a supplement. And the total for that is 1,600 milligrams. This gives you the 1,000 to 1,200 milligrams the guideline recommends, plus a buffer for the calcium that prednisone is causing you to lose. Now let's talk about vitamin D. Vitamin D is absolutely critical because it's essential for calcium absorption. Without adequate vitamin D, your body absorbs significantly less calcium from food and supplements. Studies show that vitamin D deficiency is extremely common in people taking prednisone, partly because prednisone interferes with vitamin D activation, and partly because many people are already deficient before starting prednisone. Vitamin D doesn't just help with calcium absorption, it also supports immune function, which is critical if you're taking prednisone for autoimmune conditions. Vitamin D regulates mood and helps with prednisone-induced mood swings. Vitamin D supports muscle strength, combats prednisone-induced muscle weakness. It reduces inflammation. And remember, the American College of Rheumatology recommends a minimum of 600 to 800 international units daily to meet the goal of maintaining a serum vitamin D level of 30 to 50 nanograms per milliliter. But here's the reality. Many people need more than 600 to 800 international units to reach optimal levels. This is one nutrient where testing makes sense. Ask your doctor for a 25-hydroxy vitamin D blood test. If you're deficient, you may need 2,000 or 5,000 international units daily to reach and maintain optimal levels. And make sure you're getting vitamin D3, cholecalciferol, not D2, ergocalciferol. D3 is the superior form. It's better absorbed, more effective at raising blood levels, and it stays in your system longer. So let me summarize where we are with bone protection. 1,000 to 1,200 milligrams of calcium a day from food and supplements. Split the dose, 500 in the morning and 500 at night, and include calcium-rich foods throughout the day. Vitamin D3, 600 to 800 units a day minimum, or possibly more based on your testing. Now, calcium and vitamin D are necessary, but they're not sufficient because there's a critical third player that most people have never even heard of. And without it, all that calcium you're supplementing could end up in the wrong places, like your arteries instead of your bones. Let's talk about the nutrient your doctor probably never mentioned, vitamin K2. Here's the question nobody asks. Once that calcium is absorbed into your bloodstream, where does it go? Does it automatically go to your bones? No. Calcium needs a traffic director to tell it where to go. Without that director, calcium can deposit in your arteries, your kidneys, your soft tissues, anywhere except where you really want it, in the bones. That traffic director is vitamin K2, and it's probably the most important nutrient you've never heard of. Now you might be thinking, vitamin K, isn't that for blood clotting? That is vitamin K1, found in leafy greens. Vitamin K2 is different. It has one critical job, directing calcium into your bones and away from your arteries. Without enough K2, you can end up with what's called the calcium paradox. Calcium deficient bones, osteoporosis, and calcium-filled arteries, heart disease risk, all at the same time. Your body doesn't know where to put the calcium, so it ends up in the wrong places. And here's why this matters desperately for people on prednisone. You need calcium in your bones because prednisone is causing bone loss. But prednisone also increases your cardiovascular risk by 4 times. The last thing you want is for calcium to be building up in your arteries. Vitamin K2 solves both problems. It activates proteins in your body that pull calcium into your bones, making them stronger and keeping calcium out of your arteries, keeping them flexible and healthy. Research shows that higher K2 intake is associated with stronger bones and healthier arteries, specifically the MK7 form of K2. It stays active longer in your body. Can you get this from food? The best source is natto, fermented soybeans. Most Westerners can't stand it. Aged cheeses like Gouda have some. Egg yolks from pasture-raised chickens have some small amounts, but realistically, you'd need to eat massive amounts of these foods daily to get to the therapeutic doses. Supplementation is the practical answer. One critical warning from this pharmacist. If you're taking warfarin, also known as Coumadin, do not take vitamin K2 without talking to your doctor or pharmacist first. Warfarin and K2 interact directly. If you're on other blood thinners like Eliquis or Xarelto, K2 is generally safe, but still you can check with your doctor. The combination of calcium, vitamin D3, and K2 working together, this is how you protect your bones while on prednisone. But bone loss is only one piece of the puzzle. Let's talk about the mineral responsible for over 300 biochemical reactions in your body, including the one you're probably most desperate for right now, sleep. Have you been here before? It's 3 a.m., you're exhausted, you've been in bed for hours, but your brain won't shut off. Your heart is racing slightly, your muscles feel tense, you're simultaneously wired and tired. You lie there thinking, I have to get up in 4 hours. Why can't I sleep? What's wrong with me? Nothing is wrong with you. You're just magnesium deficient. Magnesium is involved in over 300 biochemical reactions in your body. Let me say that again. 300. Magnesium is essential for nerve function and neurotransmitter regulation, muscle relaxation, including your heart muscle, blood pressure control, blood sugar regulation, energy production, bone formation. Magnesium works with calcium and vitamin D. Magnesium activates your brain's calming signals, the one people on prednisone care about the most desperately, as it's the #1 tweeted side effect, is sleep. So how prednisone depletes magnesium? Prednisone increases urinary excretion of magnesium through your kidneys. You're literally peeing out this critical nutrient before your body can ever use it. The longer you're on prednisone, the more magnesium you lose. And here's why magnesium depletion makes sleep impossible. Magnesium plays a critical role in regulating your nervous system. It activates the parasympathetic nervous system, the rest and digest system that helps you calm down and fall asleep. Magnesium helps with sleep by activating GABA receptors, your brain's calming neurotransmitter, supporting melatonin production, helping regulate cortisol levels, relaxing muscles, calming the nervous system. So when prednisone depletes your magnesium, you lose a critical tool for calming your nervous system and promoting sleep. Your brain can't produce the calm down signals that it needs. Your muscles stay tense. Your stress hormones stay elevated. Since prednisone is depleting magnesium, and magnesium is essential for sleep and relaxation, supplementing with magnesium may help counteract prednisone's stimulating effects. Here's what you need to know about magnesium. Not all magnesium supplements are created equally. The form of magnesium matters enormously. Basically, if magnesium's a little rock and it's the stuff around it that allows you to absorb it, this part matters. The best forms for sleep and absorption: number 1, magnesium glycinate. It's highly absorbable, calming, and gentle on digestion, and the best for sleep. Number 2, another option is magnesium threonate. It crosses the blood-brain barrier, supports cognitive function, and sleep. Next is magnesium citrate. It has good absorption with a laxative effect, and it's helpful if you have constipation. You definitely want to avoid magnesium oxide. It's poorly absorbed, it's the cheapest, but it's the least effective. Basically a waste of money. For sleep specifically, magnesium glycinate is your best choice. It's highly absorbable and has a calming effect on the nervous system because it's bound to glycine, a calming amino acid, and it's gentle on your digestive system. So when should you take magnesium glycinate? Take it about 30 to 60 minutes before bedtime. Magnesium works together with the other nutrients we've already talked about. It helps activate vitamin D and supports calcium absorption. It's essential for melatonin production. It's a foundational nutrient for anyone taking prednisone. Now, I mentioned that magnesium is essential for melatonin production. Let's talk about that connection. Because prednisone isn't just depleting magnesium, it's also directly suppressing melatonin itself. Let's start with what melatonin actually is, because most people think it's just a sleep supplement that you buy at the grocery store. Melatonin is a hormone naturally produced by your pineal gland in your brain. It's your body's master regulator of sleep-wake cycles. It's triggered by darkness and suppressed by light. It's essential for falling asleep and staying asleep. It's also a powerful antioxidant and immune regulator. So this is how it should work. As evening approaches, the sun is setting, light is decreasing, your pineal gland starts producing melatonin. Levels rise steadily throughout the evening and peak around 2 to 4 a.m., then decline toward morning. This rise in melatonin makes you feel sleepy, lowers your core body temperature, prepares your body for restorative sleep. So what prednisone does is, remember that study I mentioned earlier? The one where a single dose disrupted 70% of metabolites? Here's what they found about the body's natural rhythms. The study stated, a 1988 study published in the Journal of Pineal Research looked directly at this. Researchers gave 11 healthy adults just 1 milligram of dexamethasone, a steroid similar to prednisone, at either 6 p.m. or 11 p.m. The results? 9 out of 11 subjects showed reduced nocturnal melatonin production. Melatonin levels at 4 a.m. were significantly reduced. The effect occurred after a single 1 milligram dose. That's 4 times less than the other study. The clearly visible circadian rhythm prior to treatment was almost completely suppressed and deregulated by dexamethasone. Your body has natural daily rhythms. Cortisol peaks in the morning and drops at night. Melatonin rises at night and drops first thing in the morning. Melatonin rises to help you sleep. After 1 dose of steroid, that natural rhythm was almost completely suppressed. But it gets more specific with melatonin. And a more recent 2017 study looked at this in multiple sclerosis. These are patients who are receiving glucocorticoid therapy. Researchers gave methylprednisolone, another glucocorticoid, to both rats with an MS-like condition and to actual MS human patients. The results: for the rats, Methylprednisolone caused significant decrease in melatonin levels. In MS patients, after just 1 to 2 days of therapy, melatonin levels were significantly reduced. The study conclusion: since corticosteroids cause a reduction in melatonin serum levels, an important hormone in sleep regulation, their prescription to MS patients should be carefully considered. Corticosteroids could be a cause of insomnia and sleep disturbance in patients receiving this type of medication. 1 to 2 days. After just 1 to 2 days of corticosteroid treatment, melatonin levels were significantly reduced. That's the hormone your body produces to help you fall asleep and stay asleep, and it was suppressed within 48 hours. And this isn't after weeks or months of treatment. This happens almost immediately after just the first dose. If you've been on prednisone for weeks, months, or years, your melatonin production has been chronically suppressed. This melatonin suppression explains so many prednisone sleep problems. Difficulty falling asleep despite being exhausted, waking up multiple times throughout the night, early morning awakening, that's what I had, between 3 and 5 a.m. with an inability to fall back asleep, non-restorative sleep, sleeping but waking up unrefreshed, racing thoughts at bedtime, feeling wired and tired, all of these trace back to inadequate melatonin. So what can you do about it? Since prednisone suppresses your body's natural melatonin production, supplementing with melatonin may help restore normal sleep signals. According to a 2020 review in the Federal Practitioner, given the known depletion of serum melatonin levels, melatonin supplements are an attractive and relatively safe option for steroid-induced insomnia. When corticosteroids block this natural production of melatonin, you're left without one of your body's primary sleep-promoting signals. Supplementing may help replace what prednisone is taking away. So how much melatonin should you take? This is where it gets interesting, because the answer is different than what most people think. Most melatonin supplements are way overdosed. You'll see 3 milligrams, 5 milligrams, 10 milligrams, and more. But lower doses are often better, so you don't feel hung over the next day. The recommended dose is 0.5 to 2 milligrams, taken 30 to 60 minutes before bedtime. Start low at 0.5 to 1 milligram and increase gradually if needed. A critical timing point: don't take melatonin too early, like at dinner, or too late, like right as you're getting into bed. Take it 30 to 60 minutes before you're going to hit the pillow. This allows levels to rise gradually, mimicking your natural melatonin curve. A few important points. Melatonin is generally very safe, but talk to your doctor if you're pregnant or breastfeeding, have epilepsy, are on blood thinners. Just start with a low dose and increase gradually if needed. Take it consistently at the same time every night. Melatonin works best when combined with good sleep hygiene and habits and practices. Be sure to be taking prednisone in the morning, unless your doctor said otherwise. Never take prednisone at night. Avoid screens like your phone or the TV 1 to 2 hours before bed. The blue light in them suppresses whatever melatonin production you have left. Keep your bedroom cool. Block out light. I have blackout curtains that really help. I use an eye mask, and then avoid caffeine after noon. Get morning sunlight exposure. It helps reset the circadian rhythm. So we've covered bone health, calcium, vitamin D, vitamin K2. We've covered sleep with magnesium and melatonin. But there's another side effect of prednisone that's absolutely devastating for many people: uncontrollable weight gain and blood sugar chaos. And the nutrients we're about to discuss are the key to fighting back. Has prednisone ever made you do an 11 p.m. refrigerator raid? I certainly had that. Uncontrollable cravings. Well, here's the actual mechanism behind that and what you can do about it. This is not a lack of willpower. This is prednisone hijacking your blood sugar and metabolism. Here's what's happening inside your body. The first effect is it increases insulin resistance. Prednisone makes your cells less responsive to insulin. Insulin is the hormone that tells your cells to absorb glucose or sugar from your bloodstream. When cells become resistant, glucose stays in your blood instead of entering cells for energy. It's making your blood kind of like the consistency of honey. Your pancreas responds by making more insulin to compensate. High insulin equals high fat storage mode, plus intense cravings and constant hunger. Effect number 2, Prednisone increases glucose production in the liver. Prednisone tells your liver to make more glucose through a process called gluconeogenesis, even when you don't need it. So your blood sugar is elevated from two sources: glucose from food not being absorbed properly into cells, glucose from your liver making extra. Effect number 3, prednisone increases appetite and cravings. Prednisone affects hunger hormones ghrelin and leptin, and the brain centers that control appetite. You're literally hungrier on prednisone. It's not psychological. The result is high blood sugar, high insulin, fat storage, plus cravings, eating more, higher blood sugar, a vicious cycle. Now, here's something crucial about prednisone. Remember how I said the drug class is called glucocorticoids? Gluco equals glucose equals sugar. Corticoid equals cortisol-like steroid. The entire drug class is literally named after its effect on glucose metabolism. Prednisone causes insulin resistance. Your cells don't respond properly to insulin. So glucose builds up in your bloodstream instead of entering the cells for energy. Your risk of needing diabetes medications compared to people who don't take prednisone, at 12.5 milligrams a day, it's 3 times greater risk. At 25 milligrams a day, it's a 5.8 times greater risk. If you're taking 30 milligrams of prednisone every day, you have a 10 times higher risk of needing diabetes medications. And most diabetes screenings miss this because prednisone causes mainly post-meal blood sugar spikes, not fasting hyperglycemia. So the true prevalence is likely higher than reported because the tests aren't catching it. This glucose disruption worsens sleep, increases cravings, causes energy crashes, and contributes to weight gain, which is why managing blood sugar is critical while on prednisone. Now, let's talk about chromium, the mineral that can actually help reverse this. Chromium is a trace mineral, plays a critical role in how your body processes carbohydrates and regulates blood sugar. It works by enhancing the effects of insulin, helping insulin do its job better. Here's what prednisone does. Prednisone increases your chromium losses by 57%. Let me rephrase that. It makes you lose 57% more than normal people. That means you're losing more than half of your chromium stores. And chromium is essential for insulin function and glucose metabolism, regulating blood sugar levels, controlling appetite and cravings, maintaining healthy cholesterol levels, preserving muscle mass, while reducing fat storage. When you're chromium deficient and on prednisone, you get a combination where prednisone is making you insulin resistant, chromium deficiency is making insulin work even worse. The result is blood sugar chaos, intense cravings, rapid weight gain, and risk of diabetes. And here's the exciting part. Research shows that chromium supplementation can actually reverse steroid-induced diabetes. A landmark study published in Diabetes Medicine looked at this directly. Researchers gave 200 micrograms of chromium picolinate to patients who had developed diabetes from glucocorticoid use. The results were stunning. Within 1 week, fasting blood sugar dropped by over 100 points in most patients. Insulin levels decreased, hemoglobin A1C improved. Some patients were able to reduce or stop their diabetes medications under medical supervision. In 1 week, not 1 month, 1 week. And this was in patients who had already developed full-blown diabetes from prednisone. This wasn't just prevention, but the form of chromium matters enormously. This study used chromium picolinate, a highly absorbable form where chromium is bound to picolinic acid. This is very different than chromium chloride, which is poorly absorbed. You need chromium picolinate, the research-backed form. The recommended dose is 200 micrograms of chromium picolinate with meals. Especially your largest carb-containing meal, ideally take it in the morning with your prednisone. Why take it with meals? Because chromium works by enhancing insulin action, and insulin is released when you eat. Taking chromium with food maximizes its effectiveness. Now, chromium addresses one piece of the blood sugar puzzle, helping insulin work better. But remember, prednisone is attacking your metabolism from multiple angles simultaneously, so we need a multi-pronged approach. That's where berberine comes in. Berberine is a compound extracted from plants. It's an herbal source, like golden seal, barberry, or Oregon grape. It's been used in traditional Chinese medicine for thousands of years and is routinely used in certain cultures in their cooking. But modern research shows it has powerful effects on blood sugar. Here's how it works. Prednisone disrupts an enzyme called AMP kinase, your body's master energy switch that controls how you process glucose and fat. Berberine helps restore AMP kinase function. Here's what prednisone does. It blocks glucose from entering your cells, promotes fat storage, increases appetite. Here's what berberine does. Helps glucose enter your cells for energy, helps improve insulin sensitivity, and reduces fat storage. They match up perfectly. A 2024 study published in Phytomedicine found that berberine specifically helps with glucocorticoid-induced hyperglycemia, not just general diabetes or blood sugar problems, specifically the blood sugar problems caused by glucocorticoids like prednisone. Take berberine with food to help with absorption and to reduce post-meal blood sugar spikes. You can gradually increase the dose over time as you are sure that it's not going to cause stomach upset. Now, here's a warning. If you're on diabetes medications like metformin, insulin, berberine can lower your blood sugar significantly. So make sure to monitor closely and work with your doctor to adjust medication doses safely. And berberine can interact with certain medications, so check with your pharmacist. Don't take it if you're pregnant or breastfeeding. So chromium enhances insulin sensitivity. Berberine helps glucose get into your cells and restores your energy metabolism. But there's one more piece to this puzzle. Something that works synergistically with both chromium and berberine to give you even better blood sugar control. The third player in blood sugar support is called cassia bark, also known as cassia cinnamon. Research shows that cinnamon lowers fasting blood glucose, improves insulin sensitivity, reduces post-meal blood sugar spikes, has antioxidant and anti-inflammatory properties. Here's how it works. It mimics insulin in some ways. Increases glucose uptake into cells, slows gastric emptying, and prevents blood sugar spikes. It improves insulin receptor sensitivity. Cinnamon works best when taken with meals to help blunt post-meal blood sugar spikes. Now here's what makes this combination so powerful. Chromium helps insulin work better at the receptor level. Berberine helps glucose actually enter your cells and restores your metabolic function. Cinnamon slows down glucose absorption and mimics insulin activity. 3 different mechanisms, all working together, all addressing the metabolic chaos prednisone creates. And if you combine this with protein and fiber at every meal, movement after meals, even just a 10-minute walk, limiting refined carbohydrates or sugary things when possible, and staying hydrated. We've covered the major players: bone health, sleep, and blood sugar. But there are 4 more essential nutrients that prednisone is depleting right now. Nutrients that keep your heart beating regularly, your muscles contracting, your immune system functioning, and your body healing. The essential 4 are potassium, B vitamins, vitamin C, and zinc. Let's move through these quickly but thoroughly because each one matters. Potassium, the heart and muscle protector. One patient wrote, "My legs feel weak climbing stairs. Sometimes my heart feels like it skips a beat. My doctor checked my potassium and said it was a little low, but didn't seem concerned." Here's what just came out in January 2026. A medical case report documented a patient who had developed dangerously low potassium levels after starting prednisone. What the doctors found? Low potassium can cause muscle weakness and dangerous heart rhythm problems. Prednisone lowers potassium by making your kidneys flush it out while holding on to sodium and water. The study's conclusion? When starting prednisone, doctors should monitor for side effects, including low potassium. What potassium does in your body? It keeps your muscles working properly, including your heart. It helps your nerves send signals, helps control blood pressure. Prednisone triggers your kidneys to hold on to sodium and water. And sodium and potassium are always in a good balance. So when it's holding on to the sodium, it's peeing out the potassium. This is why you get swelling and muscle weakness at the same time. Signs that your potassium might be low include muscle weakness, cramping or twitching, fatigue, swelling, heart palpitations, or irregular heartbeat, constipation, numbness, or tingling. What to do about it? You can get potassium from food like bananas, potatoes, spinach, avocados, and beans are all great sources of potassium. High-dose potassium supplements require a prescription because too much potassium can also be dangerous, especially if you have kidney problems. Next, B vitamins, the energy and nerve support. A prednisone warrior wrote, "I'm exhausted all the time, even after sleeping. My hands tingle. I feel foggy and can't concentrate like I used to." Prednisone depletes several B vitamins, especially B6 and folate, also known as folic acid. B vitamins turn your food into energy. They keep your nerves working properly, help make red blood cells, support your brain function and memory, help regulate your mood. Prednisone makes you pee out B vitamins like B6. It also blocks your body from using folate properly. Some signs that your B vitamins might be low include fatigue and weakness, tingling or numbness in your hands and feet, brain fog and trouble concentrating, mood changes, depression, irritability, anemia from low red blood cells. So what you can do about it is B vitamin supplements can replace what prednisone depletes. Next is vitamin C, the immune and collagen supporter. Another prednisone warrior said, "I bruise so easily now. Cuts take forever to heal. I feel like I'm getting every cold that goes around." Vitamin C is one of the nutrients that prednisone depletes the fastest. What vitamin C normally does in your body is it supports your immune system, helps make collagen, the building block of your skin, tendons, bones, and blood vessels. Vitamin C helps wounds heal and protects your cells from damage, helps your body absorb iron. Prednisone also makes you pee out more vitamin C, so you're burning through it faster and losing more at the same time. And what's ridiculous when it comes to prednisone is prednisone weakens your immune system. That's often why you're taking it. That's why I took it, to suppress my autoimmune disease. But vitamin C strengthens your immune system, so you're literally immunosuppressed from prednisone, and now you're vitamin C deficient on top of that. This makes you even more likely to catch every cold, flu, and infection that comes your way. Vitamin C supplements can help support your immune system and keep your skin, bones, and blood vessels healthy while you're on prednisone. All right, zinc. Zinc is the immune and healing mineral. Another prednisone warrior wrote, "I've had 3 sinus infections in 6 months. My hair is thinning. My nails are brittle and splitting. Zinc is the final piece of the puzzle." What zinc does in your body is it helps your immune system fight infections. Zinc helps wounds heal. Zinc helps build proteins that your body needs. It supports your sense of taste and smell, keeps your hair, skin, and nails healthy. How prednisone steals your zinc? Prednisone makes you pee out more zinc. It also blocks your gut from absorbing zinc from food. Why this is especially dangerous? Prednisone weakens your immune system, like I've mentioned. Zinc deficiency also weakens your immune system. Together, you're way more likely to get sick. Zinc supplements can help support your immune system and healing while prednisone is depleting it. So these last nutrients I've covered might seem like minor nutrients compared to calcium or magnesium, but they're essential for keeping your body functioning while prednisone is putting it under siege. So let's step back. 11 nutrients that prednisone is systematically depleting from your body right now. Let me show you the complete picture of what we're dealing with. Here are the key nutrients prednisone is depleting from your body right now, plus the herbs and vitamins that help counteract prednisone side effects. For bone health, calcium, vitamin D, and vitamin K2. For sleep, magnesium and melatonin. For blood sugar, chromium, plus berberine and cinnamon to help counteract glucose disruption. For the immune system and healing, B vitamins, vitamin C, zinc, and potassium. I know, that's a lot. One prednisone warrior said it perfectly. Prednisone is life-saving, but sucks the life out of us. That's exactly it. The medication that's keeping you alive, treating your PMR, your lupus, your asthma, your autoimmune condition, is simultaneously stealing your quality of life. And remember, this nutrient depletion isn't optional. This is happening to your body right now, whether you address it or not. Now, imagine trying to address this on your own. You'd need to figure out which form of each nutrient actually works. Magnesium glycinate versus oxide, chromium picolinate versus chloride, vitamin K2 MK7 versus K1. You'd need to figure out the right dose and the right timing. You'd be getting 8 to 12 different bottles, swallowing 15 to 20 pills a day, trying to remember what to take when. And that's assuming you even knew about all this nutrient deficiency to begin with. Most people don't. Most doctors don't tell you. Remember when I told you about lying in bed that afternoon, unable to nap despite being exhausted? That moment when I discovered this research on nutrient depletion, I didn't just stop at reading the studies. I realized this solution doesn't exist. There's no comprehensive supplement designed specifically for people on prednisone. And if I, a board-certified pharmacist with access to research databases, had to spend hours and frankly, months and years digging through studies to figure this out, how is anyone else supposed to? I contacted a patent attorney the next day because I'd been taught in pharmacy school that supplements were basically a waste of money. But the evidence I was looking at showed something different. This wasn't about flushing money down the toilet. This was about preventing bone fractures, preventing diabetes, restoring quality of life. The research was overwhelming. The need was real, and nobody had created the solution. It took exactly 1 year, from April 2018 to April 2019, finding the right ingredient sources, finding the right manufacturer, getting the formulation exactly right, making sure every nutrient was in the optimal form and dose. And in April 2019, Nutranize Zone was born. Nutranize Zone, the comprehensive nutrient system designed specifically to counteract prednisone's nutrient depletion. Nutranize Zone contains 17 active ingredients split into 2 daily doses. The morning dose, the nutrients and herbs you need during the day when prednisone is most active, including calcium, vitamin B6, chromium, other B vitamins, vitamin C, zinc, berberine, and cinnamon. The bedtime dose, the nutrients you need for sleep and overnight recovery, including the second calcium dose for optimal absorption, magnesium, melatonin, and vitamin K2. This isn't just a random collection of vitamins thrown together. Every ingredient was chosen based on published research in prednisone-induced nutrient depletion, clinical evidence for efficacy, the correct forms for optimal absorption, strategic timing for maximal benefit. This is the supplement I created when I realized nothing like it existed. This is what I personally take. This is what I give my family to take every day. And since 2019, thousands of people on prednisone have used it to fight back against nutrient depletion. Mary said, "I think it saved me." Kelly Grisham called it a game changer. Steve said, "From 2 to 3 hours of sleep to 5 straight hours the first night." Janet said, "I regularly sleep 6 to 7 hours and wake truly rested." I want to be very clear about something. Nutranize Zone is not a magic pill. It's not going to eliminate every prednisone side effect. Prednisone is a powerful medication with complex effects that go beyond nutrient depletion. Nutranize cannot replace prednisone or cure your underlying condition or eliminate every side effect. It doesn't work overnight. Nutrients take time. But Nutranize can replace the nutrients prednisone is stealing. It meets the American College of Rheumatology guidelines for calcium and vitamin D supplementation on glucocorticoids. It improves sleep quality for many people. It helps manage blood sugar and cravings. It helps support your immune system. It gives your body the nutritional foundation that it needs to function while you're on prednisone. This is about giving your body what it needs to handle prednisone as well as possible. Look, I know many of you feel like you're not you anymore, like you're just a surprise passenger in somebody else's body. You can be grateful that this drug, prednisone, saved your life, like me, and be sad at the same time about what it's doing to you. Both of these things can be true. You didn't choose to have the condition that forced you to take prednisone. You didn't choose the side effects. You didn't choose to lose control of the steering wheel. But here's what you can control. You can control what you do to protect your body while on prednisone. You can give your body what it needs. the calcium and vitamin D for bone health, the chromium for blood sugar, magnesium and melatonin for sleep. Your body knows what to do with these nutrients. Nutranize just makes sure that you have them. This is about taking back the steering wheel, at least the parts that you can control. It's about doing everything that you reasonably can to protect your quality of life while you're on a medication you probably wish you didn't need. I'm going to show you exactly how to get started. But first, let me show you what real people just like you who were struggling on prednisone, have experienced. These are real customers who were struggling with the exact same side effects you're dealing with right now. Janet, she rarely slept more than 2 to 4 hours at a stretch for more than 10 years. Then she had to start on prednisone, and it got even worse. Here's what she said. Since taking the supplement Nutranize, and while still taking high doses of prednisone, I regularly sleep for 6 to 7 hours at a stretch and awaken feeling truly rested, never groggy. From 2 to 4 hours a night for 10 years to 6 to 7 hours consistently, while still on high-dose prednisone. Or Steve, who wrote, after tapering from 60 milligrams a day down to 20 milligrams a day, I was exhausted from the side effects. I had not slept more than 2 to 3 hours in any night for 6 months. But from the very first night I took the bedtime dose, I slept almost 5 straight hours. 6 months of 2 to 3 hours per night. First night, 5 straight hours. That's what happens when you address the magnesium and melatonin depletion, instead of just acting as if prednisone insomnia is inevitable. Our next story is about Kelly. She has lupus and was taking prednisone to manage her condition. She gained 80 pounds in 8 months. Her potassium and magnesium levels became dangerously low. Her doctors warned her about heart attack and stroke risk. The blood sugar chaos, the cravings, the swelling. It was overwhelming. She researched Nutranize for 6 months before trying it. Here's what she said. I continued to watch her videos and finally decided that it couldn't hurt to try. Seriously, what could be worse than what I was going through already? So I took the plunge. I ordered Nutranize Zone. And oh my gosh, I have lost at least 1 pound a day so far. My moon face is going down. My emotions are not all over the place any longer. I am happy again all the time. My outgoing personality is back. I'm doing physical activities with my kids again. I can walk without huffing and puffing. My potassium and magnesium levels are back to normal. The swelling in my legs and ankles has decreased. And I'm finally able to get more than 2 hours of sleep a night. Nutranize Zone is a game changer. Now, Kelly's results don't happen for everyone. Every person responds differently. The results vary. But when your body finally gets the nutrients prednisone has been stealing, this is what's possible. Mary was diagnosed with PMR and GCA in February and started on high-dose prednisone. She started Nutranize within days of taking prednisone. Here's what she wrote. To this day, I have not experienced weight gain, moon face, etc. I never gained weight. I've been sleeping well. I think it has saved me. I truly believe this has made all the difference. Perhaps I'm just a lucky one, but I don't think it's luck. I think it's Nutranize. She said, I think it saved me. Mary started Nutranize right away, before the worst side effects could take hold, and she avoided the weight gain, the moon face, the sleep problems. Is that luck? Or is that what happens when you give your body what it needs from day one? This is why I tell people, don't wait until you're suffering to start addressing nutrient depletion. Start protecting yourself now. Dr. Aaron Witten is a physician in Arizona. He's been on prednisone himself for over 15 years. Here's what he said about the research behind Nutranize. Your knowledge on this topic is rare, even among endocrinologists. You are helping people, including myself. When a physician who has been on prednisone for 15 years says the knowledge is rare, even among endocrinologists, that tells you something. This isn't common knowledge. Most doctors don't know about this. They don't know about this comprehensive nutrient depletion from prednisone. But the research exists. The science is there, and it can help. Roz's son was diagnosed with cancer. He was put on high-dose steroids, 60 milligrams of prednisone, then 16 milligrams of dexamethasone while going through chemotherapy. Roz ordered Nutranize for her son to help him maintain his strength during this incredibly difficult time. Here's what she wrote. "They are for my son, who has been on high doses of prednisone. I definitely think they helped him in controlling his appetite, moods, and sleep. I feel confident that he is replacing the nutrients that the steroids are stealing from his body. In spite of the high doses of steroids, and now on chemo, he remains stable and strong. My son's oncology team has approved them for him." Her son's oncology team approved Nutranize. When you're dealing with cancer and high-dose steroids, nutrient repletion isn't optional, it's critical. And when medical teams are approving this for their patients going through chemotherapy, that says something about the quality and safety of the formulation. Next, we have Thomas. He's 80 years old. He's been taking prednisone for 19 years, and he's been taking Nutranize Zone to manage nutrient depletion. "I'm still active and healthy. I credit part of that to taking Nutranize Zone consistently for the past several years. It's helped me maintain my bone health and energy." 19 years on prednisone. 80 years old, still active and healthy. That's what long-term nutrient support can do. Bill was tapering off prednisone, trying to go from 20 milligrams down. He tried to drop from 20 milligrams to 15 milligrams, and it didn't work. He relapsed and had to start over. Then he started taking Nutranize Zone and changed his tapering approach, going down just 2.5 milligrams at a time, slowly every 4 to 5 days. Here's what he said. "With your supplement, I believe it has made things much easier. 2 people I will give my thanks to. Number 1 is God, and number 2 is Dr. Megan. Tapering is one of the hardest parts of prednisone. Your body is recovering from months or years of adrenal suppression. You're still dealing with nutrient depletion, and you're trying to find a delicate balance between too much prednisone and not enough." When Bill said Nutranize made things much easier, that's what I hear over and over. Nutranize doesn't replace medical supervision during a taper, but it does give your body the nutritional foundation it needs to handle the taper better. And many people choose to continue Nutranize even after they're completely off prednisone to help their body recover from what it went through. Sarah has been taking Nutranize Zone for 69 months. That's nearly 6 years. But let me tell you how her journey started. Sarah had been on prednisone for years, managing her lungs and autoimmune disease. She was suffering moon face, weight gain, anxiety, depression. In her own words, "I was miserable. I was going crazy." She did her own research, trying to find something, anything to help, and she decided to give Nutranize Zone a try. Here's what she said after just 1 month. "Within a month, I was feeling normal again. I can't believe I found something natural to help me with my prednisone side effects. When I am finally off prednisone, I won't stop taking Zone. It has changed my life." Literally. Within a month, she felt normal again. And here's what makes Sarah's story so powerful. That was nearly 6 years ago. She's still taking it, still on prednisone. And here's what she says now, after 69 months. "When I found these supplements to help with my side effects, I found relief. The miracle in a bottle you created for all of us suffering from prednisone. I will take Nutranize forever." Sarah found relief, not from eliminating prednisone. She still needs it, but from giving her body what it needs to handle it. She felt the difference in a month, and she's been taking it for nearly 6 years because it works. These are real people, real struggles, real relief. They're not paid actors. They're not professional testimonials. They're people just like you who are lying awake at 3 a.m., staring at the ceiling, staring at themselves in the mirror and not recognizing their reflection, standing at the refrigerator, cravings they couldn't control, worried about bone fractures and diabetes, feeling like a passenger in their own body, and they found a way to take back some control. So here's what I want you to know. You don't have to keep suffering through prednisone side effects alone. You don't have to accept that this is just how it has to be. There's a better way. Let's bring this all together. You now understand what's happening in your body. Prednisone isn't just causing random side effects. It's systematically depleting at least 11 nutrients from your body. Nutrients that control your sleep, your mood, your metabolism, your blood sugar, your bones, your energy. Calcium, vitamin D, vitamin K2, magnesium, melatonin, chromium, berberine, cinnamon, B vitamins, vitamin C, zinc, potassium, plus additional support from vitamin A and other key nutrients that we just didn't have time to go into. You have two options. Option one, try to piece this together yourself. Buy 8 to 12 different bottles from different brands. Try to figure out which forms to buy. Magnesium glycinate or oxide, chromium picolinate or chloride, vitamin D2 or D3, K2, MK7 or MK4. Figure out the right doses. Time everything correctly. Remember what to take when. Swallow 15 to 20 pills a day, each with their own fillers, flow agents, and who knows what other additives or potential toxicities you're getting from cheap manufacturing. And then worry, are these ingredients safe to take together? Could any of these interact with my prednisone or my other medications? Could any of these make my underlying condition worse? Am I accidentally taking something that works against what I'm trying to accomplish and spend $250 or more per month and then hope you got it all right? Or option two, use the system I created specifically for people on prednisone, a system designed by a pharmacist who understands drug-nutrient interactions, who knows which ingredients work together and which ones don't, who formulated this specifically for prednisone users, not despite them. Just 4 capsules a day, 2 in the morning and 2 at bedtime. That's it. Nutranize Zone. So the morning bottle has everything you need during the day when prednisone is most active. Calcium, 500 milligrams, the first dose for bone support. Vitamin D3, 600 international units, enhances calcium absorption. Chromium, 200 micrograms, the exact dose shown to reverse steroid-induced diabetes. B vitamins for energy and metabolism. Magnesium, zinc, vitamin C, potassium, and berberine, and cinnamon for blood sugar. The bedtime formula. You just take 2 capsules at 30 to 60 minutes before bedtime. It's everything you need for restful sleep and overnight recovery. Calcium, 500 milligrams, the second dose for optimal absorption. Magnesium glycinate, the highest absorption form for sleep. Melatonin, 2 milligrams, 1 in each capsule, to restore what prednisone steals. Vitamin K2, MK7, directs calcium to the bones, not the arteries. Additional B vitamins, vitamin C, chromium, 17 ingredients, 2 simple doses per day, morning and bedtime. All the right nutrients in the right forms, at the right doses, at the right times. Everything you need in one comprehensive system. Now, if you tried to buy all of this separately in the right forms and doses of high quality calcium in the proper form with a split dose, that's about $25 a month. Vitamin D3, a sufficient dose, is about $15 a month. Vitamin K2, MK7 is about $30 a month. Magnesium glycinate, not oxide, is about $25 or even $70 a month. I paid that myself. Chromium picolinate is $15 a month. Melatonin is $12 a month. A B complex with the active forms is $25 a month. Vitamin C is $15 a month. Zinc is $15 or more a month. Berberine is $40 a month. Cassia cinnamon is $15 a month. Total, you're going to be spending at least $250 or more. Nutranize Zone gives you everything in one system, just 4 capsules a day at a fraction of that cost. You have several ways to get started. Most people choose subscribe and save. You'll never run out, you lock in the best price, and you cancel anytime easily. Or if you prefer one payment, there's 6-month, 3-month, or 1-month options. All packages include free shipping and my 90-day money-back guarantee, plus a free Prednisone Warrior resource kit that includes educational materials, checklists, and support so you know how to taper, get restful sleep, and lose the prednisone pounds. Click the link below to see all package options and current pricing. Or you can call me directly at 435-429-0934. That's my direct line. I personally answer it. And yes, I really do answer my own phone. People are always surprised, but here's why I can do that. This product works so well that we have very few customer service issues. Most of my calls are people asking questions before their first order or calling to tell me how much better they feel. That's the kind of product this is. Here's my promise to you. Since the ingredients in Nutranize Zone are designed to replenish what prednisone steals and help you feel more like yourself again, you'll feel the difference faster than you might think. However, in the unlikely event that you don't feel a positive difference after taking Nutranize Zone for at least 1 month, I refuse to keep even a penny of your money. Just contact us within 90 days of your order and let us know how we can do better. If you're not satisfied, we'll refund 100% of what you paid, excluding shipping. But shipping is free unless you expedite it. You don't even need to return the empty bottles. That's how confident I am that Nutranize Zone is going to work for you. Why am I this confident? Because thousands of people on prednisone, some for 10, 15, even 16 plus years, tell me the same thing. I haven't felt this good in years. Janet's sleeping 6 to 7 hours a night now after 10 years of insomnia. Steve sleeping 5 straight hours on his first night. Kelly managing her blood sugar and feeling like herself again. Mary avoiding the worst side effects entirely because she started on day 1. Thomas staying active and healthy at 80 after 19 years of prednisone. Sarah taking Nutranize for nearly 6 years and calling it a miracle in a bottle. This works. Not for everyone, not perfectly, not overnight, but it works for enough people consistently enough that I can offer this guarantee with complete confidence. You have 90 days to decide. That's 3 full months to try it out. If it doesn't help, you get your money back. All of it. You literally have nothing to lose. But here's what I need you to understand. Every day you're on prednisone without nutrient replenishment and support, the depletion continues. Every day is more calcium lost from your bones, more magnesium drained from your nervous system, more chromium depleted from your metabolism, more sleepless nights, more uncontrollable cravings, more risk of fractures. The research on bone loss is clear. It happens fast in the first 3 to 6 months. 30 to 50% of people on long-term prednisone develop osteoporosis, but it's preventable. Scenario 1, you wait and you think, I'll see how it goes for a few more months. 6 months later, you're still exhausted, still can't sleep, still worried about bone loss, and you've lost 6 more months of bone density that you can't get back. Or scenario 2, you start today. You give your body what it needs, starting right now. 6 months from now, you're sleeping better, your energy has returned, your cravings are under control, your bone density scan shows protection, not further loss. You feel more like yourself than you have in months or years. Which scenario do you want? The choice is yours. But the sooner you start, the better your outcome will be. So how do you get started? It's simple. Step 1, click the link below or call me at 435-429-0934. Step 2, choose your package. Most people choose subscribe and save for the best value and convenience. Step 3, your Nutranize Zone ships immediately with free shipping. Step 4, start taking it. 2 capsules in the morning with your prednisone dose and 2 at bedtime. Step 5, give it at least 2 to 4 weeks to start noticing the difference. Get started now by clicking the link below or call me 435-429-0934. If you're reading this or watching this video at 2 a.m. because prednisone won't let you sleep, if you're dreading your next bone scan, if you looked in the mirror today and barely recognized yourself, I've been there. I know what it feels like to need a medication that's saving your life while simultaneously feeling like it's stealing your quality of life. You shouldn't have to choose between treating your condition and feeling like yourself. Nutranize Zone isn't a miracle cure. It's not going to eliminate every side effect overnight, but it does give your body what prednisone steals, so you can sleep more deeply, feel steadier emotionally and physically, regain your energy, protect your bones, take back control of the steering wheel. You already made the hard choice to start prednisone because you needed it. This is the easier choice. Support your body while you're on prednisone. A 90-day guarantee, nothing to lose, everything to gain. Click the link below to see your package options, or call me directly 435-429-0934. I'll personally answer your questions. You deserve to feel more like yourself again. Let Nutranize Zone help you get there to better sleep, better health, and feeling like you again. I'm Dr. Megan Milne, the Prednisone Pharmacist, signing off.